There are many circumstances and medical diagnoses that may cause an individual to approach the end of their life. The natural aging process and chronic conditions such as heart failure, HF chronic obstructive pulmonary disease, COPD, cancer, and advanced dementia may lead to end-of-life care. All nursing care should be provided in a holistic, person-centered approach, but during end-of-life care, all caregivers must be fully attuned to the needs and wishes of the person. Caregivers often have a long-standing relationship with the dying person, but it is critical to not assume their client's preferences. Communication must be more frequent and intentional during end-of-life care, because a patient's needs can change quickly. Additionally, attitudes and mental outlooks often fluctuate for the patient and their loved ones during this difficult time when many decisions need to be made. It is essential for caregivers to find an appropriate balance of interventions and space for the dying person and their loved ones. Use techniques discussed earlier in the course for therapeutic communication and making observations of facial expressions and body language to guide your interactions with the resident and their loved ones. As discussed earlier in healthcare settings, hospice care is a choice offered to individuals approaching end of life. Hospice care is offered to patients who are terminally ill and expected to live less than 6 months. Hospice provides comfort to the client and supports the family, but curative medical treatments are stopped. It is based on the idea that dying is part of the normal life cycle. Hospice care does not hasten death, but focuses on providing comfort. For example, a cancer patient may choose to no longer receive chemotherapy due to its severe side effects, but will continue to take medications to manage pain and nausea. While nutritional intake is still important, food choices center around those that are pleasurable to the client, rather than meeting their daily requirement of nutrients. Hospice is a service provided by Medicare and can be delivered in a person's home or in a facility such as a nursing home or hospital. To qualify for hospice care, a hospice doctor and the client's primary doctor must certify that the person is terminally ill with a life expectancy of 6 months or less. The client signs a statement choosing hospice care instead of curative care covered by Medicare. Hospice coverage includes the following: all items and services needed for pain relief and symptom management, medical, nursing, and social services, medications for pain management, durable medical equipment for pain relief and symptom management. Hospice coverage includes the following: aid and homemaker services, physical therapy services, occupational therapy services, speech-language pathology services, social services, dietary counseling, spiritual and grief counseling for the client and their family. Hospice coverage includes the following: short-term inpatient care for pain and symptom management in a Medicare-approved facility, such as a hospice facility, hospital, or skilled nursing facility that contracts with the hospice agency. Inpatient respite care, which is care provided in a Medicare-approved facility, so the usual caregiver, like a family member or friend, can rest. The client can stay up to 5 days each time respite care is needed. Respite care can occur more than once, but only on an occasional basis. Other services that Medicare covers to manage pain and other symptoms related to the terminal illness and related conditions the hospice team recommends. After 2 physicians agree that a person qualifies for hospice, a nurse from a hospice agency completes an assessment and makes care recommendations. If the client is in a nursing home, their hospice team will coordinate with the facility team to manage the client's needs and wishes. Visits are scheduled at intervals designated by the hospice team. A hospice nursing assistant may come to the facility to provide cares because they can spend more time with the enrolled hospice client than routinely provided by the facility staff. This extra time can reduce pain that may occur during cares by moving at a slower pace and allowing for periods of rest. The additional social interaction is also beneficial for the hospice client. To improve quality of life, hospice may also provide additional resources such as spiritual chaplains, music therapists, or volunteers who simply visit with the client if they do not have friends or family available. If a hospice client remains in their own home, the hospice agency provides durable medical equipment like a hospital bed and other items to make caring for the client easier, such as a commode, shower chair, or mechanical lift for moving the client. The hospice nurse and nursing assistant visit regularly based on the needs of the client and their family. The nurses or nursing assistants' visits may also serve as respite, allowing the loved ones a reprieve from caring for the client themselves. Nursing assistants may choose to work for a hospice agency and receive additional training to better understand and provide end-of-life care.